Heart is an amazing muscle that beats about 100,000 times a day. The heart is what keeps us all going, pumping oxygen-rich blood that other organs need, like the lungs, brain and kidneys. Simple day-to-day actions can reduce your risk for heart problems while providing all the other benefits of a healthy lifestyle. Take care of your heart with these easy tips. Eat a good balanced diet. The following categories of food are recommended: fruits and vegetables, whole grains, low-fat or fat-free dairy, protein-rich product, unsaturated fats like olive oils. Withdraw on the bad stuff. Cut back on the following: saturated fats, like butter and cheese, trans fats, added sugars, salt. Read food labels so you know what you're eating. Regular exercise. Studies show that sedentary people are more likely to have a heart attack than active people. Physical activity can help your heart in many ways, from lowering your blood pressure to reducing stress and helping you manage weight. Aim to get at least 150 minutes of activity a week. These are a number of quick ways to easily add more physical activity into your days. Take the stairs instead of the elevator. Walk around the block. Clean the house vacuuming, dusting and even doing laundry. Walk around when using a cordless or cellular phone. Visit your healthcare professional. Your healthcare team can help you assess your heart health status, develop goals for healthy living and recommend necessary screenings, tests, procedures and medications to keep you feeling your best. Manage your stress levels. If you're under a lot of stress, you may be more likely to smoke or exercise less. These may lead to heart problems. Stress can also negatively affect your heart health in many ways, from raising the risk of high blood pressure to impacting cholesterol levels. Exploring healthy ways to confront and cope with your stress can support your heart health as well as your overall health. Get enough sleep. Sleep is an essential part of keeping your heart healthy. If you don't sleep enough, you may be at a higher risk for cardiovascular disease. One study found that those who slept fewer than 6 hours per night were about twice as likely to have a stroke or heart attack as people who slept 6 to 8 hours per night. Researchers believe sleeping too little causes disruptions in underlying health conditions, including blood pressure and inflammation. Aim to sleep for 6 to 8 hours per night. Don't sit for too long at once. In recent years, research has suggested that staying seated for long periods of time is bad for your health. They also found that in those who sat the most, there was an associated increase in cardiovascular events. In addition, sitting for long periods of time, especially when traveling, increases your risk of deep vein thrombosis, or a blood clot. It's important to move throughout the day. Park farther away from the office, take a few shorter walks throughout the day or use a standing workstation so you can move up and down. And remember to exercise on most days. Work on bad habits. Unhealthy habits like smoking, heavy drinking and taking illicit drugs can have various impacts on the heart, from narrowing blood vessels to making your heart muscle more prone to pumping problems. Smokers are almost twice as likely to have a heart attack compared to those who've never smoked. If you use tobacco, quitting is one of the best things you can do for your heart health. Learn the signs and symptoms of a heart attack and what to do when it happens. If you believe that you or someone you know has a heart attack, act fast to get help. Knowing the signs and symptoms of a heart attack and what to do when it happens will come in handy in saving your or someone else's life. Work on keeping your weight down. If you're heavier than you should be, your risk of high blood pressure, high cholesterol, and type 2 diabetes is above normal. Eating less sugar and saturated fat, while cutting back on alcohol, eating more fruit and vegetables and getting more exercise, can all help you lose excess pounds. Aspirin. A small daily dose of aspirin can lower the risk of heart attack or stroke in many patients who are at increased risk of heart disease, including those with diabetes or narrowing of the arteries. Talk to your doctor to find out if daily aspirin is a good idea. Know your health status. Regular blood pressure, blood sugar, and cholesterol checks are important to keep the heart healthy. High blood pressure and cholesterol are silent killers, which means that you won't know you have them unless you get tested. It's recommended to go for regular cardiac checkups, especially after 35 years of age. Know your family history. If in your family, any female below 45 years and any male below 50 years has had a heart attack, then your risks of getting a heart problem increases. So get evaluated by a cardiac specialist regularly to know your heart condition, as prevention is better than cure. Consume dark chocolate. Dark chocolate not only tastes delicious, it also contains heart-healthy flavonoids. These compounds help reduce inflammation and lower your risk of heart disease, as suggested by scientists in the journal Nutrients. Eaten in moderation, dark chocolate can actually be good for you. Floss and brush your teeth regularly. Good oral hygiene does more than keep your teeth white and glistening. According to some research, the bacteria that cause gum disease can also raise your risk of heart disease. While the research findings have been mixed, there's no downside to taking good care of your teeth and gums. Floss and brush your teeth daily to ward off gum disease. Be happy. A sunny outlook may be good for your heart, as well as your mood. According to the Harvard School of Public Health, chronic stress, anxiety, and anger can raise your risk of heart disease and stroke. Maintaining a positive outlook on life may help you stay healthier.